Hello, everyone, and welcome to Talk Nerdy. Today is Monday, September 29th, 2025, and I'm the host of the show, Dr. Cara Santa Maria. And as always, I want to thank those of you who made Talk Nerdy possible this week. Remember, this show is and will always be 100% free to download. We rely on a model just like your local PBS station or NPR station does. It's support of listeners just like you that make it so that those who can't afford to pay can still listen to the show for free. The platform I use is Patreon, so if you're interested in pledging your support on an episodic basis, all you've got to do is visit patreon.com/talknerdy. This week's top patrons include Chuck Blell, David J.E. Smith, Daniel Lang, Mary Neva, Joseph Lamore, Anu Badavaj, David Compton, Brian Holden, Gabrielle F. Jaramillo, Ulrika Hagman, and Pasquale Gelati. Oh, and Joe Wilkinson, you're there too. Thank you all so very much. All right, I am ready to dive right in if you are. I had the incredible opportunity to chat this week with Dr. Tom Frieden. Now, after 9/11, he was a commissioner of the New York City Department of Health and Mental Hygiene from about 2002 to 2009, where he was involved in banning smoking in the city's restaurants and also banning the serving of trans fat. After that, he was appointed to direct the Centers for Disease Control and Prevention, the CDC here in the U.S., and was the administrator of the Agency for Toxic Substances and Disease Registry from 2009 until 2017. So that was under the administration of President Barack Obama. And currently, he works as the president and CEO of Resolve to Save Lives, which is a global initiative that works on preventing epidemics and cardiovascular disease. He was trained as an infectious disease and public health physician, and he has a new book out. It's called The Formula for Better Health: How to Save Millions of Lives, Including Your Own. So without any further ado, here he is, Dr. Tom Frieden. Well, Tom, thank you so much for joining me today.
It's great to talk with you, Cara. I'm looking forward to the conversation.
Absolutely. So much to get into. First and foremost, you have a new book, The Formula for Better Health: How to Save Millions of Lives, Including Your Own. We're going to get into that formula. But before we get into that formula, I would like to sort of introduce you a little bit more deeply. You are the former CDC director and commissioner of the New York City Health Department. I'd love to know how one gets to be in that position. Like, what did you study in school? What was your primary focus? And how did that evolve throughout sort of your academic career before you started working in public service?
Cara, one of the fun things about writing the book was talking about some of the things that made me who I am. And one of the most important was my father. My father was a wonderful cardiologist. He was what we call a doctor's doctor. All the doctors who had heart problems would go to him for care. And he really suggested to me the field of public health. And in fact, he told me when I went to college, I knew I wanted to go to medical school. He said, don't be a pre-med. Do the minimum of pre-med requirements because you'll spend the rest of your life studying that stuff. Spend your college time getting a good education. So I was a philosophy major. I studied Wittgenstein and I applied philosophical concepts to psychological and ethical problems.
Man after my own heart. My focus for my PhD is existential psychology, and that's where I really do all of my clinical work, is in deep existential issues that my patients, who are often cancer patients, are facing. So I love philosophy as well, and I think it's a real, I guess, disappointment when I hear about students getting through college having never engaged with philosophy.
So I did the bare minimum of pre-medical requirements. It was fun telling the pre-meds I was a philosophy major, and the philosophy majors I was a pre-med.
Yeah.
And then I went to medical school and I did public health school at the same time.
Okay.
Then I did a residency in internal medicine, and I did that at the height of the AIDS epidemic in New York City. And it was really a searing time because I took care of hundreds of people for whom really I couldn't do much more than to help them die comfortably.
Yeah.
And it's a terrible situation to be in where you're taking care of patients, but there's so little you can do for them. And then I became an infectious disease specialist. And after that, I became a disease detective, what's called an epidemic intelligence service officer at the CDC. And that's how I joined CDC. And it just happened to be that I was assigned to New York City at the time of a major, in fact, the largest outbreak of multi-drug resistant tuberculosis the United States has ever experienced. So I first documented that outbreak as a disease detective, figured out where and how it was spreading, and then was put in charge of stopping it. Did that for 5 years and then went to India for 5 years to work on tuberculosis. And then Mike Bloomberg won the New York City mayoralty and asked me to come back home and be health commissioner. I had worked for the health department for many years. It's a great health department in New York City. And I was born in New York City. I did my medical training there. I had done much of my professional work there. And 9/11 had just happened. And I just felt it was time to come home. So I did that for 8 years and then became CDC director for 8 years. So I've been lucky in the opportunities I've had, in the mentors I've had, and I've learned through projects that worked and projects that failed at work. And from that, I really have come to recognize that there is an approach that works, and you have to get it right or people will die. And that approach is a formula, a very clear way of approaching not just public, but also personal health problems to see what's really going to kill you, to believe you can change it, and then to systematically figure out how to create a healthier future.
I love that. And we're going to get into that in like kind of more specific detail soon. I'm curious, something that jumped out for me as you were going through your training and kind of early in your career, you had a large focus on tuberculosis. Was that simply due, I mean, simply is maybe not the right word here, but was that due to the fact that that is the crisis that was facing you right then? Or did you choose in your training to um, to specialize in a particular area of infectious disease because of a personal interest or because of kind of a research background?
I don't know if tuberculosis found me or I found tuberculosis, but when I started off as an infectious disease specialist and epidemic intelligence service officer at CDC, it was my first public health job. I love clinical medicine. I love taking care of patients. And in the public health field, we don't do a lot of that. And if we do it, it tends to be very episodic, people who you see when they're very sick, with the exception of tuberculosis, where you're taking care of someone for many months. So I volunteered to work in a tuberculosis clinic as I started my EIS, my disease detective training. Now, did I do that because TB was on the rise? I don't know. Maybe, maybe not. But it was a way of being involved clinically and at the same time addressing a public health problem and also addressing something that I knew was relevant both in the United States and globally, because I knew I wanted to work in global health as well. My father had asked me when I became health commissioner. I went to see him. He was very ill in his nursing home by then. And I told him actually, Dad, I want to be the best health commissioner. Not that I'm competitive or anything. And he said, and he was very ill at this point with Parkinson's disease. And these ended up being actually the last words he ever spoke to me. But when I said, I want to be the best health commissioner, he said, how would you know? And it was such a profound question. Tuberculosis was the crisis of the day when I was starting out in public health. And tuberculosis globally continues to kill more people than any other infectious disease. And that's so painful because it's 100% curable.
Yeah. Yeah, it's one of these diseases that we often, I think especially young people think about as a faraway disease or a bygone disease without making the connection that many diseases, measles, polio, that we think of as being far away or bygone, really we only think that because we have had such good public health measures, because we have been protected from these diseases. But that is not a foregone conclusion, is it?
One of the things that I thought hard about and studied in the book was something called the Cassandra curse.
Hmm.
The Cassandra curse is from Greek mythology. Cassandra was a priestess who was gifted with foresight. She could see the future, but she was cursed. Nobody would believe the prediction she made, and therefore they didn't change their behavior, and therefore terrible, predicted, preventable tragedies occurred. And in a lot of ways, public health has been like a Cassandra. We can
Yeah.
tell you with pretty good certainty how many people will die, when, from what causes, in what groups. But until recently, we haven't been able to break that curse. And it also holds for individuals that in our own lives, there are things that are pretty likely to kill us, but we don't take actions. And I realized as I wrote the book with really horror that public health's Cassandra curse is even worse than Cassandra's. Because in the Cassandra curse, we don't pay attention to things that might kill us in the future. And yes, public health has that curse. But in public health, in a way, it's even worse because we don't pay attention to the things that would have killed us in the past, but didn't because of public health. There are 8 billion people in the world, and I'm certain that not one of them woke up this morning and said, "Oh, thank goodness I didn't die yesterday from smallpox."
Yeah.
And yet
Yeah.
smallpox killed more than 100 million people in the last century.
Absolutely. There's almost a, I don't know if it's, a specific type of logical fallacy or cognitive bias that I often hear from people who um, are, I guess, I don't like using the word skeptical because I consider myself a scientific skeptic. So more denialists, I guess I could say, like vaccine denialists or individuals who do have a lot of fear around certain public health efforts, where it's that born yesterday bias, like, well, why do we need to be vaccinated against measles? Measles isn't a problem. I don't know anybody who's ever had measles. And it's like, that's because we're vaccinated against measles. But there's this strange loop of thinking that I often see where people have a false sense of security that's actually due to the very measures that they don't think we need.
Absolutely. And what I came to recognize is that the reason we have this Cassandra curse, the reason we don't pay attention to the threats that could kill us, is because we have inaccurate perceptions
Mm.
of ourselves, of our world, and of the future. And without getting into all of the details that I break down, one of these, for example, is that we assume that the decisions we make are our decisions, made with kind of complete, unfettered free will. We decide what we're going to do. Well, our decisions are largely determined by the social norm around us. They're largely determined by what companies do to market or to change their products. And once you realize that the decisions you make and other people make are not just what you're conscious of doing, but what is going to happen if you go with the flow in the social context you're in, you can be more understanding of yourself and others, and you can recognize those influences and change them. Another real inaccurate perception is something called the prevention paradox. The prevention paradox in public health shows that the biggest changes in society, in health, often come from little changes to everyone rather than big changes to a few people.
Mm.
And it's kind of counterintuitive, but if you take lead poisoning as an example, acute episodes of lead poisoning where people die and terrible problems happen, they're terrible and they're very visible, but a much larger cumulative or collective amount of harm is done by slight increases in lead levels for millions of people. And the same is true for benefits. One of the things that we can do to live longer and healthier is to address our most important dietary deficiency, which is potassium. We can increase our potassium a little bit. We won't feel different, but if everyone in society did that, it would prevent millions of heart attacks and strokes. Now, this prevention paradox has a political corollary. Because the costs are concentrated, but the benefits are diffuse, the few entities that would have to do something different, like tobacco industry or polluting factories, can organize and stop public health action, whereas the beneficiaries may not even have been born yet. Mm-hmm. And this is one of the things we have to recognize and counteract. Just to give you one more driver of this Cassandra curse, it's a fancy term, hyperbolic discounting. We shortchange the future. If every smoker knew that they had a 50-50 chance of dropping dead after their next cigarette, not a whole lot of people would smoke.
Absolutely.
But smokers do have a 50% chance of being killed by tobacco. It's just that it's going to be a long time in the future. So we can figure out a way to make that distant future feel like tomorrow, either with short-term benefits or just imagining what it would be like. We can take action that protects ourselves and our communities.
It's interesting because I think that this sort of mentality, I see it across several aspects of our daily lives and several aspects of our political spectrum. It seems to be almost a human folly, but maybe it really is built into our cultural systems, that we have a hard time thinking about risk. We have a hard time thinking about externalized costs, and we really struggle with downstream effects. And of course, we have a political machine that focuses on tomorrow. It doesn't focus on 10 years from now. That may not be expedient. That's not part of my election cycle. And I think it does affect everyday people all the time, that we have a hard time thinking about how small changes today could affect us in a decade, in 2 decades, in 3 decades, could affect our children, our grandchildren, and so on. I mean, we see that with climate change. We see it with public health. We see it with so many difficulties and really like existential crises that we're facing.
I think one of the main findings of our work is it is possible to make progress, but it's only possible to make progress if we recognize the challenges. And there are ways to build coalitions. There are ways to make clear what the short-term benefits will be, so it's not just about long-term benefits. There are ways to identify who the champions and advocates are. There are ways to make visible what may be invisible about the current harms or the future benefits. One of the things, for example, that we did about tobacco when I was CDC director was the program called Tips from Former Smokers, where we found real Americans who were really suffering from tobacco-associated disease. And they told their stories. And what we learned was that what motivates people to stop smoking is seeing the disability and disfigurement that smoking actually causes. It's not that you're going to become the Marlboro Man or a very attractive young person by smoking. You're going to end up with a hole in your throat, or being unable to walk across the room, or having a stroke, or having cancer, and looking bad and not being able to do the things that you do. And by making those costs more visible, more real to people, we empowered people to do what they wanted to do, which was to quit smoking.
And so I'm curious, how does this fit into your formula? If you could review for us one more time the different variables, the different steps to that formula, so that then we can look at each one in a little more detail.
So there are 3 steps to the formula. See, believe, create. See the invisible. See the threats, the trends, the toxins. See whether what we're doing is working or not, and see the pathway to progress. Second, believe we can change that, shatter this illusion of inevitability, the normalcy bias that we have, that the world is going to continue the way it always has. And we can do that by recognizing past progress, by making phased further progress and by cultivating and maintaining optimism. And then the really hard part comes. It's hard enough to see the invisible and believe the impossible, but the third stage, create a healthier future, requires a very specific approach, organizing well, simplifying, because you're not going to succeed if it's complicated, communicating effectively, and overcoming barriers, those barriers that exist because we're out for the most good, but that's going to hurt some companies that sell deadly products.
Mm-hmm. So there's this incentivization to not see or to not believe, definitely to prevent organization or prevent simplicity. I'm curious, I think very often those of us who maybe don't work within these systems but are looking at them from not just the outside but from our own individualistic or personal or familial perspective, maybe there's a misunderstanding or a misconception that part of the reason that we're maybe not where we want to be, or haven't made certain types of progress that we want to make, and again we have made a ton of progress, is because it's too hard, it's too expensive, we don't have the solutions, we don't have the data. But really, we can see the invisible, we have a lot of really good data. I'm concerned about the I guess the agenda or the intentionality behind some groups who at different periods of time hold political power, refusing to admit that very data or trying to manipulate that data to say, oh, this isn't a problem.
I think it's important to emphasize that there has been progress.
Mm-hmm.
Sometimes some groups in public health and otherwise are really quite reluctant to say things are better, because it can be difficult to keep in your mind that things are better but still bad,
Mm-hmm.
but better. And I think the concern comes from the risk that we'll say, mission accomplished, take your foot off the gas, you can relax, we've done what we need to do. I think the reverse is true. Showing that we've made this much progress also increases our responsibility to make even more progress. And the fact is, we're healthier than we've ever been in human history. We have better tools to find, stop, and prevent disease. We have everything from blockbuster drugs to more effective vaccines, to better ways to collect information, to better ways to analyze data. We are basically poised for much more progress, but we need to see the forces that are blocking that progress and then figure out how to overcome those barriers.
And so how do we overcome sort of the force that we mentioned before? I think it's a fitting question for this concept of seeing, right? That there's a certain, I guess we can say, cross-section, whether they're everyday citizens or whether they're individuals who hold political power, who see the progress, but refuse to connect the progress to these public health initiatives. So they say, why do I need for my kid to have a Hep B vaccine? I don't have any risk of Hep B, and I'm going to refuse that vaccine. Or why do I need a COVID vaccine? People aren't really dying of COVID all around me. I'm going to forego that vaccine. That sort of that tendency to forget or to not see exactly why it is that we are as healthy as we are right now.
Seeing the invisible means seeing the things that might kill us.
Mm-hmm.
And most people with hepatitis B infection don't know they have it. And 10, 12, 14% of pregnant women don't actually get a hepatitis B test during their pregnancy. And if your infant gets infected in childbirth, they've got a significant likelihood of dying young of liver cancer or liver failure. So this safe, effective vaccine is preventing death from liver disease at a young age. Part of this involves rebuilding trust.
Yeah.
And it's clearly the case that COVID broke trust. It fractured some of the common reality that we have and led to such an increase in groups that don't know who to trust, that are really concerned. And I think that's really dangerous because there are lots of times when trust is really important. And it's the only thing that can't be surged in an emergency. You can build trust bit by bit by providing assistance and programs that people can see and that make a difference in the problems that they care about. That's why I think it's really problematic that what we've seen recently is words and actions that are actually the exact opposite. We see RFK Jr. saying he wants to take on environmental contamination, and this administration relaxing rules that will get forever chemicals like PFAS out of our water, or eliminating rules that would reduce deadly soot, PM 2.5, that causes an estimated 100,000 deaths a year. When public health works best, it isn't about telling people what to do. It's about making it so that the easiest thing to do is also the healthiest thing to do. The fact is, the plain fact is, that if you go with the flow in America today, you will end up overweight or obese. And that's a dramatic change from a couple of generations ago. And it's not because our willpower has changed. It's because our environment has changed. It's because we're consuming massively more sugary beverages than before. And there is no difference calorically or health-wise between a sugary drink that has high fructose corn syrup and a sugary drink that has regular sugar. So what we're seeing is kind of performative things that address real challenges, but with pseudo solutions.
And often pseudoscience. I mean, I think one of the things that I struggle with the most working in sort of a capacity of science communication is a tendency, and I think this has been, fostered and curated over several decades, maybe even several generations, of putting a lot of onus on individual choice and individual volition. People feeling ultimately responsible for everything that happens in their lives. I see this play out a lot with the cancer patients with whom I work. If only I had eaten more, green beans, I might not have gotten cancer. And it's a very toxic and difficult mentality to work through. What I worry about is that we often spend so much time talking about the individual and not enough time talking about the forces, whether they be multinational corporations or media darlings or individuals in positions of political power who are actually peddling the very pseudoscience or intentionally describing anti-public health measures, actually pushing for things that do not make us healthier, or what I find is, I think, sort of the most pernicious, pushing for kind of get healthy quick schemes that are really just scams to make money off of people. I really struggle with the amount of pseudoscience that I'm seeing right now within the realm of individual health and public health as a whole.
What I try to do in this book is provide not only a public health path to progress, but also a personal health path to progress. This framework, See, Believe, Create, is not just about public health measures, whether it's tobacco control or prevention of cardiac disease, heart attacks and strokes, or vaccination, or removing environmental contaminants. It's also about personal health. And it's not either or. It's not that there's either a societal responsibility or a personal responsibility. It's both. We as a society need to do certain things, and everyone as individuals can do certain things to live longer and healthier. Nobody is going to slap sunscreen on you. Nobody is going to move your legs so that you get more physical activity. So I think it's both. And one of the things about science communication and about science versus pseudoscience, simple versus simplistic, fact versus fiction, is being clear about nuance. And this, unfortunately, doesn't work well in a soundbite. But, Kara, the flaw, I think, in a lot of the things we see, and not just in the, pseudoscientific snake oil salespeople, but even in the major media, is a lack of understanding of the nuance. That when it comes to how certain we are about an intervention, there's a spectrum. There are things that we're certain of. We're never going to find out that smoking is good for you. There are other things that are likely correct, but we have to be humble because good science doesn't lead to certainty. It leads to humility. The more you understand a topic, the more you say, well, this much I know, but there's a lot I don't know also. And then there are other things that are likely correct, but we're actually not certain that they're correct. We have some data. And then there's a fourth category. There's almost certain, likely, possible, and then there's wild guess. Yeah. And there's a lot out there masquerading as certain that's wild guess. It may have a very rational sounding reasoning process, paleo diets, cold plunges, resveratrol for everyone, vitamin E. And these things have either been shown not to work or never been shown to work.
Yeah. And yet they continue to be described, I think, for, several reasons, whether we're talking about that very distrust of institutions that we were describing earlier, whether it's an idea of, like you mentioned, simplistic versus simple. It sounds reasonable and logical without getting into the nuance, and it's some sort of alternative option. I get to be the one in the know. I'm now choosing to go the path that the institutions are not telling me to because I no longer trust them. But there's also, I think, even sort of beyond, I guess, complexity, those different categories that you mentioned of like certainty and complexity. There's a concern that I have when it comes to pseudoscience. Yes, part of it is I'm saying that I'm certain about this thing when the data don't back that up, but that a lot of these individuals who fall, and I like to say this, victim to pseudoscience, individuals who really are concerned about the health of their families, the health of their children, the health of the public. They fall victim to these because they're trying to see the invisible, but they have no idea how to separate the wheat from the chaff. They don't know how to separate the good science from the pseudoscience. How can we, as public health communicators, as science communicators, but also how can individual consumers of this who don't have, degrees in science and aren't trained in how to read academic papers, be confident that they're able to separate good science from pseudoscience?
It's hard. It's really hard. And I think it starts with saying, if anyone is trying to sell you anything, don't believe anything they say. And this is one reason, actually, I made sure that all of the proceeds from this book, The Formula for Better Health, will go to programs that support health. I don't get a penny.
Wow.
And my organization and I have never taken any money from pharmaceutical companies. We don't now. We never will.
Yeah.
You have to start with avoiding conflict of interest. And one of the things that's really striking about what Mr. Kennedy is doing is that you can pretty much anticipate that anything he's accusing other people of doing is what he himself is doing. Yeah. We've seen, and this is an area where I know well because I worked on it for many years, the Advisory Committee for Immunization Practices. It's what was previously a little-known committee. It had 17 members. They were extensively vetted for conflicts of interest. 16 had no conflicts. One had done some vaccine research, and so distinguished researcher recused herself from decisions about the vaccine she worked on. And he said, these people have terrible conflicts of interest, and he fired them all, and he put onto the committee 12 people who actually do have quite severe conflicts of interest. So he said he was going to clean it up, give best science, and he's done the exact opposite. And if you look at the people around him, they're selling stuff. They're selling stuff that is not proven to work, and they're also suing companies for things. And I'm okay with suing companies if it's for something bad they've done. But what they're trying to do is to say, oh, vaccines cause autism, which has been proven not to be the case. And it's a big disservice to the families dealing with autism. And what's coming next is every child with autism is a multi-million-dollar suit to the vaccine manufacturers.
Right.
Follow the money. So you have to start with, is there any conflict of interest? And if there is, don't believe a word they say.
And broaden up, I think, to add to that, broaden up your perspective of what a conflict of interest is and of what makes money. Because I think there's a real misunderstanding in this society that, big pharma controls everything, and that, the kind of supplement industry is this like small, it's a David and Goliath situation, or that these sort of unproven treatments that are often peddled are, quote, alternative simply because big pharma doesn't want to give them a chance, without realizing that the supplement industry is a multi-billion-dollar industry with massive interest in keeping the FDA from regulating them. Like I just think that there's a lot of misinformation that really positions sort of the institutions that we've known for a long time as quote unquote evil, and anything alternative to it as like a breath of fresh air.
One of the really dangerous things about this direction is the concept that medicines are bad and all natural stuff is good. The bubonic plague is natural.
Right.
We've got medicines that are really underused. Medicines for high blood pressure, medicines for unhealthy lipids, medicines to cure hepatitis C. And what's common about those conditions is that all of them have no symptoms. You feel fine until you have a heart attack or a stroke or liver cancer or liver failure. Our health system is really bad at treating conditions that are asymptomatic. And there are good points that these folks make. I do think our kids are over-medicated for things like attention deficit disorder. We clearly give unsafe medicine to people who have pain rather than do the hard work of figuring out where that pain is coming from and how it can be effectively addressed. And that's partly because of the way the financing of our healthcare system works. We pay for procedures, we pay for visits, we pay for hospitalizations. If a health system helps their patients become healthier, they don't make any more money.
Right.
And that's a real big problem, with the exception of programs like Kaiser Permanente, where the group that pays for the care is the same group that provides the care, and therefore they have an interest in their members being healthier. And guess what? Kaiser Permanente is twice as likely to control their patients' blood pressure as the rest of the country. Their control rate is about 90%, and it's about 45% in the rest of the country.
Wow. Yeah. Yeah. It is interesting where we put that onus, where we put that incentive. I'm curious, does the way that our health system, the managed care system in the United States, we're one of the only developed nations who has such high health costs with such poor outcomes connected to it. Is that part of your formula as well? Or is that a whole secondary concern that could work, kind of an overhaul of our health system could work synergistically with your formula for better public health?
It's extremely important to it. And if I can go into some detail, I talk about an initiative that I created as CDC director called the Million Hearts Campaign. We realized that in the next 5 years, there would be 10 million heart attacks and strokes in the US. And we figured if we could just decrease that by 10%, we would prevent 1 million heart attacks and strokes. So we had a major effort. It had White House approval. It had the Health and Human Service Secretary's office tracking it weekly. It had more than 50 national organizations signing on. It had commitments from the part of HHS that oversees 10,000 community clinics, from CMS that determines how people are paid and educated, from CDC, from FDA. And we really tried hard, and we failed. And we failed really because of those things that drive the Cassandra curse. We failed because we failed because we failed to change the incentives in the healthcare system. In most of the healthcare system, if you do a better job treating your patient's blood pressure, you will actually not only not make more money, but you may actually have to spend more money. You've got to reach out to people, bring them back, titrate their medications. It takes a lot of time, and you don't get a penny more in reimbursement. But if you do that, they're going to have fewer heart attacks and strokes, and your system will lose a lot of money because that's where the money comes from. Procedures, angioplasties, rehabilitation, intensive care. And so it's not that any single doctor in the whole US wants their patient to have a heart attack or stroke, but it is that the structure of our healthcare system ensures that that is the outcome.
Yeah.
If it were really important to all of the healthcare systems and all of the insurers to get blood pressure controlled, then we would all be like Kaiser Permanente, with 90% of people instead of 45% of people having a healthier blood pressure.
Yeah. And so do you believe that one of the core reasons behind that really is because of that financial incentive? And if we built a structure that put the incentives in different places, maybe took the power out of the insurance companies, for example, that we would see change almost just by virtue of making that change?
I know that's the case because that's what we see at Kaiser Permanente, Geisinger, Mayo Clinic, Intermountain Health, all of these integrated systems where you make it in the incentive, in the best interest of those who pay for care, for people to be healthy, then you get a much healthier future. I know it because all around the world, we see that the countries that do best have an emphasis on primary health care. 100 million Americans lack a primary health care provider. That's just outrageous. We spend more than $4.5 trillion a year on healthcare, and we can't even give people the basics, a clinician, a doctor they can trust for 100 million people, basically nearly 1 out of 3 Americans.
Yeah. So how did you navigate this? When you were the CDC director, when you were the commissioner of the New York City Health Department, you can look at this data and you can say unequivocally, look at what's happening in these other developed countries, look at what's happening in these closed systems like Kaiser. But when there is no political will, when somebody can look at those very same data and say, nope, I don't believe it. Nope, that's not what we want for our people. I mean, that must be incredibly frustrating.
You have to choose your battles. You have to be ready to fight, and you have to see what you can do that's going to make a really big difference. For example, artificial trans fat. This is created by bubbling hydrogen through liquid oil. It turns it solid. It makes a really good pie crust. It's solid at room temperature. It's also solid in the arteries that provide blood to your heart, your coronary arteries. And therefore, it was accounting for an estimated 500,000 deaths per year. When I was New York City Health Commissioner, we took on artificial trans fat and we banned it from all of the restaurants in New York City. And industry said the sky would fall, it'll be terrible, we won't be able to make all these products. But when push came to shove, after we regulated, all it took was each of the restaurants calling up their oil supplier and saying, send me the trans fat free variety. And overnight, we got it out of New York City. It prevented literally hundreds of deaths per year. And it spread to all of the US, and now my organization, Resolve to Save Lives, which focuses on scaling up effective, practical solutions to the world's deadliest health threats. We've worked with more than 50 countries to ban this toxic chemical that was in a lot of food. Now, more than 4 billion people are protected by laws that make their food trans fat free. And the models suggest that that will result in at least 9 million fewer deaths in the future. So you find your battles, you organize systematically, you simplify the message, you communicate effectively, and then you figure out how to overcome those barriers. We don't want to tilt at windmills and try to do things that are impossible. We don't want to focus on things that are problems of yesterday. We want to focus on the things that are on the bubble, on the things that if we focus, if we're strategic, we have a reasonable chance of success. And that's the case for public health measures, and it's the case for your personal health as well. There are ways to make real progress living a longer and healthier life just by focusing on a few things that can make a really big difference.
So tell me, Resolve to Save Lives, this is the global health organization that you founded, that you're the CEO of. What are some of those initiatives? What is some of that action against the world's deadliest health threats? What have you guys identified as some of those deadliest health threats where we can take action?
There are a few areas where we work. One is the prevention of epidemics. A lot of the epidemics that happen and a lot of the harm from the epidemics that happen don't have to happen. What we've done is to work with more than 30 countries to support programs that find problems faster and stop them sooner. We launched an approach called 717, that every outbreak would be found within 7 days, reported to public health within 1 day, and all essential control measures in place within 7 days. And that every outbreak would be assessed, yes or no, did it meet 717, not to blame people, but to figure out what worked and what didn't. So we'll be better off the next outbreak. And what we're seeing is very rapid improvements in rapid detection and rapid response and quick stopping of epidemics. We saw this in Ebola. When I was the CDC director, we implemented a program called Rapid Isolation and Treatment of Ebola, RITE, RITE. And with the right strategy in Liberia, the teams there were able to stop the outbreaks twice as fast, and they were able to triple survival rates. So rapid detection, rapid response to epidemics is one broad area that we work in. A second is prevention of heart attacks and strokes. High blood pressure is the only thing that kills more than 10 million people a year. It's accounting for 1 out of every 5 deaths in the US and around the world. And there's a lot we can do to reduce blood pressure. One is very simply to increase the amount of potassium we consume and reduce the amount of sodium we consume. And this can be as simple as switching the brand of salt you use to a potassium-enriched low-sodium salt. Potassium deficiency, which most of us have, is our deadliest dietary deficiency. And that gets lost in all of the influencer stuff on eat this, not that. Mm-hmm. We are also scaling up the effective treatment of high blood pressure. When we started this program, many of the countries we work in had control rates, that is, the proportion of people with high blood pressure who are adequately treated, in the single digits. And with simple, scalable, affordable programs using all generic medications, we've seen control rates double or triple or increase even 4 or 5 or 6-fold.
Wow. Wow. So I'm curious here as we're sort of getting towards the end of this hour. Help us out a little, those of us who are listening and we're excited about the words that you're saying, but we're also struggling to see good right now. We're struggling with hope and we're struggling with feeling heard, that against what I might consider, I'm 41 years old, so I've lived through, quite a few sort of big global events, but of course I was not alive during many, and there will be more to come. I have a perspective that many of my friends and colleagues have, that this is one of the darkest times for our democracy here in the United States. There is a real difficulty in finding hope because we fear that many of the things that you're talking about here, see the invisible, believe the impossible, create a healthier future, would be much easier if there weren't forces at play refusing to see or trying to change the narrative around what is possible or what health even looks like. Help us out a little bit, because I hear hope in your voice and I hear a lot of kind of, I don't know, confidence, optimism, positivity. Where do you find it, and how can you help us find it for ourselves?
Well, first off, we shouldn't underestimate the challenges we face. The same
Mm,
forces that create the Cassandra curse we talked about earlier make it really hard to break.
yeah.
Uh, Killer industries, tobacco, alcohol, junk food, fossil fuel, and others systematically sabotage the solutions. They prevent us from seeing by hiding the harms they have and funding misleading research. They block belief in change, trying to convince us that things have always been the way they are when they often aren't. We're, for example, consuming massively more soda than we did before. And to block action, they lobby effectively. So, yeah, there are big problems, and we're not going to maintain optimism by pretending those problems don't exist. But we can be strategic. We can recognize that despite all the problems, we have better tools than we've ever had in all of human history. Despite all of the bad things that some of the social media and artificial intelligence can do, there are also great advances. We can use those tools for good. They're tools. They can be used for good or for evil, and we can
Mm,
use them for good. So there's more that we can do now than ever before. And, I'll tell you a story from the time of my uh, leading the New York City tuberculosis control program. Our health centers were in terrible shape. They were filthy and dilapidated, unsafe actually. And it took years, but we got a multi-million-dollar renovation plan approved. And then the mayor changed and Rudy Giuliani became mayor. And
mhm,
we thought we were going to lose all of that hard work that we had done. There was a letter sent from the New York Coalition to Eliminate Tuberculosis to Mayor Giuliani in the first week of his time there. And it said that they demanded that the clinics be renovated. And that letter kind of sifted down to my desk to draft a reply. And I didn't know what to say. So I kind of drafted a wishy-washy answer that said, we'll do our best. And it went up to the mayor's office and it came back with a handwritten note from the deputy mayor saying, no, tell them we're going to renovate those clinics. And that one letter saved the clinics. And that letter from the New York Coalition to Eliminate Tuberculosis, that letter was written on a manual typewriter by a guy named Charles Ehlers, who was a cured TB patient. And the New York Coalition to Eliminate Tuberculosis was him. He was the only member of it. So it's really possible to make a difference, but we have to be strategic. We have to be realistic. We have to build. We have to recognize not everything is going to work. But facts are stubborn things.
mm.
Even if they're denied, misused, suppressed, they remain facts. It doesn't change. And fundamentally, we have great people working on the front lines, nurses and doctors and outreach workers, social workers and others who know what's really happening on the front lines and who really care and do great work from day to day, day in and day out. And the public wants to be healthier. They care about their kids being healthier. One of the things that is so tragic about the misinformation spreading is that it's hijacking. It's hijacking the CDC and using the CDC brand to push junk science. It's hijacking the sincere concerns of people that they're worried about the toxins in our environment. They're worried about the commercialization of our health system. They're worried about not knowing who they can trust. I think we can recognize that these are real challenges, but that we have really strong grounds for optimism. It's not just misguided. It's not delusional to think we can make more progress, but it's delusional to think we can make more progress unless we fight.
Absolutely. So let us know, how can individuals learn more about Resolve to Save Lives? Maybe, support it if that's something that they want to do to feel like they are, part of that solution, or just see a little bit about those boots that are on the ground, about those, really brave individuals who are on the front lines, who are affecting change.
For Resolve to Save Lives, you can go onto our website, resolvetosavelives.org. I also have a Substack, The Formula. And if you're on Substack, please subscribe. All of the proceeds from that formula will go to programs that we support around the world, programs like one in Bangladesh that's treating hundreds of thousands of people for high blood pressure who were not treated before. Programs like ones in Nigeria that help healthcare workers be safer so they don't get deadly virus infections from caring for people on the front lines. Programs like those in South Asia and East Asia that are banning trans fats so people aren't going to have heart attacks. So those are two websites people can go to. But I would also say, bloom where you're planted. Whether it's your physical community or your demographic community or your friends and family, build community, strengthen those linkages. Not only will it make you feel better, but actually having people who you enjoy speaking with and who listen to you and you listen to, that probably helps you live a longer and healthier life and reduce the risk of dementia and other disability. But also we can strengthen those bonds of community, and they can be online communities or physical communities that are essential for making progress. Every single community has strengths, and it's possible to enlist those strengths to address the challenges that the community chooses to take on for itself. And don't forget that the concerns that people come from, leave aside the grifters who are selling snake oil. The concerns that people have, they're valid concerns. They're confused about what to do. They're concerned about what's in their environment. They're committed to making their families healthier. And those are positive things. We need to listen to the concerns and address them.
Ugh. Well, gosh, everybody, the book is The Formula for Better Health: How to Save Millions of Lives, Including Your Own. Tom, I can't thank you enough for being here. I can't thank you enough for the incredible work that you've done over such a long and rich career, and really putting the health of individuals who you will never meet right there in the forefront. And thank you for taking an hour to spend this time with us today to inform us, to enrich us, and also hopefully to motivate us a little bit. It's been wonderful chatting with you.
Thank you, Kara. It's been fun. And, as a parting thought, our minds are amazing things. And some of the ways they work get us in trouble from some of the pitfalls that lead to things like the Cassandra curse, where we ignore problems that might kill us or kill millions of people in society. But our minds are also wonderful things because we can be rational, we can understand, we can use the psychological hacks to see where there are real threats, to recognize that we have made a lot of progress and we can make even more, and then to join together and create a healthier future for ourselves, for our kids, our families, for our communities, for the country, and for the world.
Hear, hear. Gosh, and everybody listening, you are part of that group. Thank you for coming back week after week. I'm really looking forward to the next time we all get together to talk nerdy.